Hello, everyone, and welcome to another edition of What's Up, Doc. Today we have Dr. Thomas Hodgkiss. He is with Southern VIP. It is a vascular center that has branches in Tennessee, Kentucky, and Mississippi. You can go to southernvip.com to find out their specific locations. But just about every week, we like to have a doctor on because we have our network of 12,000 patients across the globe that have a lot of burning questions about peripheral artery disease, that poor circulation in mainly the legs. Dr. Hodgkiss has an expertise in PAD, but even more importantly, there are very few PAD specialists that truly specialize in PAD pain beyond just simply restoring blood flow in the arteries. A lot of times with patients with PAD, they end up getting treatment too late for a variety of reasons. Mainly, they were either misdiagnosed sooner versus later versus sooner, or they ended up with a doctor who said, I'm not going to treat you until you have a wound on your toe that won't heal. And meantime, all their tissue is just dying little by little. And by the time they get that blood flow restored, the damage has already been done to the nerves. So he specializes in some new treatments in regards to that to help patients a lot. But we want to welcome him. We want to get to your questions as well. So make sure to put them in our chat, whether it's in our comment section on YouTube, Facebook, Twitter, wherever you might be tuning in. Also, we do have a live studio audience who may be jumping in as well. Do make sure we have Josh, our YouTube producer, who is on standby waiting for your questions to come in for Dr. Hodgkiss. So get them in now, and don't forget to like this video and subscribe to our channel as well for more great content like this. And with all of that being said, welcome, Dr. Hodgkiss. Thank you for taking the time.
No, thanks for having me on. It's wonderful to be here.
So why don't we start with where your greatest passion lies when it comes to the treatment of PAD?
Probably the easy answer is total care. And it's taking care of that patient from the day they walk in the door. I see a lot of clinics, they get the referral, they treat the blockage, and they send them back. And we don't do that. When that patient joins us, there's the vascular side of our clinics, and then there's the pain side. And so when you come in the door, it's where do you go if you have leg pain? And almost all we do a questionnaire risk assessment. If it's high, they automatically get an arterial ultrasound and TBI, toe brachial index. And if that's elevated, that to me, that's number one. That's so much more important than back pain, which I think they probably have. We go down the vascular side. And to me, you've got to restore blood flow to see how much relief you can get by doing that before you head down the pain treatments. And a lot of times you can intermingle the two as we go along, whichever becomes more expedient.
Do you get a lot of patients that are referred to you simply for diabetic neuropathy and they have never had a vascular evaluation? And you're sitting here going, whoa, 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 wait. Before we look at these additional pain treatments, let's just simply get you the TBI or the ABI or a leg artery ultrasound. Let's rule out the circulation issues.
Right, right. No, exactly. It's that's the first place we go is to evaluate the blood flow. And and it's amazing how everybody, I've got diabetic neuropathy, there's nothing I can do about it. I can take a gabapentin. And
Yep.
it's like, and then the next question is, has anybody looked at your blood flow? And then they tell you, well, I've got chronic renal disease and I used to smoke 40, a pack a day for 40 years, and right down the path you go. And they've got heart disease and that kind of thing. So we get that evaluation and then start to work it up. And yeah, the first thing, if it's abnormal, we markedly abnormal, and the patient is very symptomatic. The symptoms correlate with the findings on exam and on the ultrasound studies. And at that point, we'll go to treatment. So
Yeah. When it comes to the Global PAD Association, we have our Leg Saver hotline. And of the more than 1,000 tangible saves that we've had since inception in 2019, 35% the patients that called our hotline at 833 PAD legs, 35% were told that their amputation was being performed due to diabetes. Not one had a diagnosis of PAD prior to finding our hotline. And can you guess the percentage of those patients that actually proved to have PAD?
Oh, it'd
100%.
be close to 100%. Yeah.
100%. Every single one of those patients proved to have PAD, even though doctors said that the amputation was due to diabetes. The infection that you have, it's due to just diabetes. Now, that being said, it's not to say that there aren't instances where the amputation is due to diabetes, because I have had those situations. We do have patients that have come to us where literally they have fantastic flow going through the main arteries, and then it is those smaller capillaries that end up having the issue, and they end up with an infection to the bone, osteomyelitis, and that spreads, and they do need an amputation due to the diabetes. But in my experience, those are few and far between. What about you?
Right. No, it's so many of the people, they show up with that diagnosis and they get an ABI. It's normal. And nobody gets the TBI to check the flow from the ankle to the toe. And now with the loop procedures and our big meetings in Nashville this week, and I was at dinner last night. I love the fact that so many of those guys are doing the loop. They're treating the distal arteries in the foot. And that's exciting because it just works. You've seen it, you know it. And the naysayers are the ones that have never done a loop, never treated the arteries in the feet. And so you go and you open up those arteries and you see how much relief they get. I'm astonished. I expect to come back and do, as we'll talk about later, so spinal cord stimulator, some kind of additional treatment. And I would say it's 10 to 20% that most of them get enough improvement. They're like, I'm fine. I'm not normal, but I'm so much better.